Thank you, Chair. Good afternoon, everyone. The Honourable Dr. Roosevelt Garrett, Prime Minister of Dominica, Minister of Investment and Governance. The Honourable Dr. Cassandra Williams, Minister of State in the Ministry of Health, Wellness and Social Services, with responsibility for senior security, children at risk, gender affairs and differently abled. The Honourable Dr. Orlando Brewster, Minister of National Mobilization, Social Development, Gender Affairs, Family, Youth, Housing and Informal Settlement in Saint Vincent and Grenadines. The Honourable Gloria Thomas, Minister of State with responsibility for social development and gender affairs for the government of Grenada. Mrs. Monica Schaus, Permanent Secretary of Grenada as well. Mrs. Sheila Laver, Deputy Permanent Secretary in the Ministry of Public Service, Home Affairs, Labour and Gender Affairs from St. Lucia. Chairperson, Mrs. Melissa Morgan, Director, Bureau of Gender Affairs, Ministry of Health, Wellness and Social Services, Dominica. Mrs. Janie Joseph, Director of Gender Relations in St. Lucia. Mrs. Jemima George Richardson, Head of Gender Affairs in St. Vincent and the Grenadines. Mr. David Eric Simarfirst, Secretary, High Commission of Canada and Barbados. Mrs. Tony Rodber, Representative of UN Women, Multi-Country Office for the Caribbean, and co-chair also of the Build Back Equal. Senior and all government representatives here today, representatives of the media and all online. Very good afternoon to all of you. It's a pleasure for me to be here. I'm extremely grateful to be here from Norway originally, and it's my very first time to visit the beautiful and lush island of Dominica for this inaugural meeting of Building Back Equal. This initiative is supported by UN Women and UNFPA, UN Population Fund, with a very generous funding from the Government of Canada, as you have heard. And I bring you also greetings from our Director for the sub-region of Caribbean, Mrs. Elizabeth Talbert, who's not here with us today. And I also want to extend a special thanks to the partners, the project partners and participating stakeholders of this project who are here or online, and especially to the host, the Commonwealth of Dominica, as well as Grenada, St. Lucia and Saint Vincent and Grenadines, for the partnership for this project. We also want to extend thanks to regional partners such as the OECS, that is very important for the implementation of this project. And allow me also to really underline that this project would not be possible without the commitment of the Government of Canada to a feminist international assistance policy based on human rights and targeted approach to gender equality and the rights of women and girls, which also includes the priority towards their sexual health and reproductive rights. Thank you for that. Our collective ambition, as you have heard today, is to build the economic resilience of women in Eastern Caribbean by addressing the barriers they face, with the recognition that access to sexual and reproductive health and rights and gender-based violence services will be key to achieve this goal. At UNFPA, we champion the right of every woman to bodily autonomy, the right to freely make decisions about the number, timing, and spacing of children without any discrimination or coercion, and the right to achieve highest attainable standard of sexual and reproductive health. UNFPA is fully committed to zero unmet need for family planning, zero preventable maternal deaths, and zero gender-based violence and harmful practices, as was founded in the International Conference on Population and Development in 1994, which we are celebrating the 30th anniversary of in 2024. Fulfilling the rights of women and girls is central to the achievement of the Sustainable Development Goals and the ICPD Program of Action. And as such, this regional launch is really very timely. As we set our sights on the achievement of the SDGs in 2030, very close, around the corner, this work is actually more urgent than ever. And we need to work together in new ways, across sectors and across stakeholders, to accelerate progress against the SDGs. And this has to be done based on evidence and data. My key point here today is actually that the Building Back Equal project will enable us to do exactly that. As we have seen this morning, the project has enabled to convene partners across sectors to come together on a holistic approach of putting the rights of women and adolescent girls at the center. Our aim is to address key barriers of economic resilience but also to look across the SDGs of how women exercise their sexual and reproductive health and rights, and thus empowering them. This will translate into transformative change in the lives of women and girls, and especially those furthest left behind. Indeed, we're very proud to be part of this initiative because it enables us to bolster the support of long-standing partnerships that we have with the 4 governments that are represented here today. In fact, we have been a trusted partner since 1969 in the Caribbean. This is important because while that data really demonstrates that we have made huge progress, fewer women are dying in childbirth, more unintended pregnancies are prevented, and young people's opportunities are hugely expanded. But the reality is that more work needs to be done. And importantly, data shows us that teenage pregnancy remains high in the Caribbean if you look at global standards overall. And this is impacting young women's potential to become fully empowered and indeed independent to contribute to economic resilience. So it's really crucial that we understand the interrelation between early childbearing and low educational attainment and social economic development. Many girls, for example, drop out of school when they become pregnant in their teenage years. And this negatively impacts on the girls, but also their children and their families and the country at large. Therefore, delaying early childbearing has huge investment of return, both at macro and micro level, beside the human rights issues involved. And global and Caribbean level studies and data show us that investing in family planning is a high return investment. A study published by UNFPA in 2021, covering the SIDS impact, included 4 countries of the Caribbean, including St. Lucia, concluded that investing $1 only in family planning and maternal health will pay off $27 in economic benefit by 2040. So this confirms early findings and evidence which shows that family planning is a development best buy. And by this I also want to say that the Building Back Equal gives us a unique opportunity to really support national priorities towards climate resilience and sustainable results. It is grounded on national ownership priorities, civil society engagement, and capacity strengthening. These are issues that we have discussed this morning. For example, in terms of UNFPA's intervention, we will focus on developing more robust healthcare systems, particularly linked to sexual and reproductive healthcare services, with focus on those that are the most marginalized. Our partnership will be key with ministries of health, and our support will range from policy, evidence-based technical support, to civil society, to empowerment activities, with special attention to persons with disabilities and those that are survivors of gender-based violence. And the Building Back Equal project also integrates the unique context that has been mentioned earlier of the necessity to build resilience against shocks from climate change and natural disasters. Focus will be, in this sense, on the adult-centered youth and women and those furthest left behind, specifically working with the ministries of health and linking it to also gender-based violence. Finally, let me once again really thank the opportunity for coming here to Dominica. Honorable Prime Minister, it's really an amazing opportunity for us to be here to kickstart this program, and the long-standing partnership with the government of Dominica. We are committed as UNFPA to supporting Dominica and also the priorities that have been mentioned today in the National Resilience Development Strategy of 2030. Ladies and gentlemen, partners, UNFPA is fully committed to this partnership, and which will really have the opportunity to improve the lives of many women and girls and young people in Eastern Caribbean. We will work with you to ensure that reproductive health and protection needs of women and young people are addressed as a critical enabler for economic resilience and empowerment of women. The goals are actually ambitious, but we are confident that we can directly reach and benefit over 100,000 women of reproductive age who will have access to quality sexual and reproductive health services in the 4 countries of Build Back Equal by the end of this project. When women and girls make the most fundamental choices about their bodies, they do not only gain in terms of autonomy, but also through advances in health, education, income, and safety. Thank you all for this partnership and in making the shared goal of Build Back Equal a reality.